I want to go over some of the nuances of how to optimize kidney health. I know you've had a great series of talks before me, so some of this might be repetitive and some of the things that you heard in the other talks might, kind of roll over, but I'm going to try and be a little more kidney specific and see how we can optimize our kidney health. So the objectives of my talk are to focus on things like what exactly happens and how can we manage after our kidney function after nephrectomy or a kidney surgery or removal of an entire kidney or parts of the kidney. And then go over some of the functions that the kidney does and how to manage that in the setting of a reduced kidney function or presence of cancer and medications that might affect the kidney function, like electrolyte balances, fluids, and how to manage that, and managing hypertension also, because that's one of the things we rely very heavily on the kidney to help us balance. So let's start off by, and you might have heard some of this before, but it is very crucial to understand that kidney disease and kidney cancer or cancer of any sort have a very close-knit relationship. And about 1 in 3 patients of kidney cancer will develop kidney disease or tend to develop kidney disease in some form or the other as they go along through either the therapy or surgery or the post as a consequence of the whole, experience of having gone through cancer therapy. So this not just holds true for kidney cancer, but also chronic kidney disease gives rise, or rather predisposes patients to various forms of cancer. So whatever information I give to you today about kidney cancer kind of, relates and kind of spills over into just cancer treatment as general as well. So, talking about kidney cancer and cancer in general, there are several types of treatment strategies. There is surgery, where part of the cancer is removed or part of the kidney is removed, or sometimes the entire kidney is removed or a kidney and a half is removed, depending on the extent of the cancer. Then oftentimes radiation is used. Immunotherapy is another big one. There are certain medications called targeted therapy, cryoablation. And oftentimes these therapies can be used in combination with each other, making things a little more challenging than just one single therapy, because many therapies could have various side effects. So what exactly happens when these therapies are implemented? The biggest thing that happens is it helps treat the cancer. But unfortunately, no good deed goes unpunished. And as a result, so if a kidney cancer is treated by surgery or a part of kidney is removed, we have a decrease in the kidney mass. As opposed to having 2 fully functioning kidneys, if we just have half of one kidney and just one other half, or if we have only one kidney, that decreases the kidney mass. Sometimes certain therapies can cause long-term scarring. Sometimes the immunotherapies or certain medications which are used to boost the immune system in order to kill the cancer could affect the kidneys as innocent bystanders and cause inflammation. And certain targeted therapies can have microstructure damages in certain structures of the kidney. And all these things eventually lead to decrease in kidney function. And then as a result of decrease in kidney function, the functions of the kidney are sort of deranged a little bit, like electrolyte management, fluid management, and blood pressure management. So how do we, so what exactly happens when somebody has to go through the nephrectomy surgery or part of their kidney is removed, right? And what is generally the outcome of kidney health or kidney function after the procedure? So this all depends, the eventuality all depends on what the baseline is, or what do we start off with. So how good is the kidney function? Somebody who already has deranged kidney function to begin with, and then you take a part of the kidney out or the entire kidney out, that leaves you with even little reserve or little leftover kidney function as compared to somebody with just fully functioning 2 kidneys, and then a part of the kidney is removed as a part of cancer treatment. So so where we start matters a lot. Then the compensation from the remaining kidney. So even that matters, even that depends on where we start off. If we have one healthy kidney, it can, work harder, it can kind of make up for the loss of the other kidney, as opposed to if we have reduced kidney function, then it might have, it might put additional stress on that one kidney that we have. Now, like I said, again, what we start off with is what matters the most, right? So, oftentimes I tell my patients that, when we are discussing or when we are thinking of what happens after somebody has cancer or even kidney cancer for that matter, we want to think of it in two ways. We want to think of it in how the patient is doing and how the kidneys are doing in particular. If the patient has bad diabetes or poorly controlled high blood pressure or several other medical problems, that itself, we are starting off with a more challenging situation. And then on top of that, you add kidneys that are not too strong. Now we're dealing with, even more challenges as compared to if somebody does not have any other comorbidities and if their kidney function is otherwise okay. So all these factors are very important in understanding and determining the fate of the kidney function after cancer and therapies. Also, the medications patients are taking and how they affect the kidneys play a very, very vital role in determining what happens eventually after either kidney cancer therapy or cancer therapy in general. So, how do we manage the kidney function? How do we say if there is a patient who has slightly reduced kidney function to begin with and loses a kidney for kidney cancer, so what happens next, or how do we go about it? So the first thing is surveillance, or what we call is keeping a close eye and kind of monitoring your kidney function. So asking your doctor to check your kidney function frequently, asking your doctor to check if there is blood or protein in the urine. These are not normally present, and if they are, then those are some signs or subtle signs of problems in the kidney microstructure. Having a good control of other issues like diabetes, blood pressure, staying well hydrated, having a good control of blood pressure with medications. Importantly, trying to avoid certain medications like ibuprofen, painkillers. Sometimes for cancer patients, we need to use contrast dyes to get studies often. So then kind of having a very careful discussion with your oncologist and saying that, hey, doc, listen, I just heard about these dyes that are not good for the kidney. So how can we optimize? Sometimes they will call the kidney doctor and then we might recommend some IV fluids ahead of time or things like that. It is important to have good nutrition, stay active, and exercise. It might be very, very difficult, especially when you're going through chemotherapy and all of these things to, stay active or even have a good amount of nutrition, but it definitely adds to having a good nutritional status, definitely adds to helping the kidneys function well as well. So some of the other things to think about: try to avoid alcohol, smoking. Whenever you're started on a new medication, trying to take a minute and talk to your doctor about what are the potential side effects. Would they have any side effects on your kidneys? This shows a CT scanner, so trying to avoid unnecessary dye contrast. Having good blood pressure control, a healthy, well-balanced meal, and trying to avoid too much of weight gain or too much of weight loss. When somebody is going through cancer therapy, these are easier said than done. But just some things to think about, simple things like taking a minute and thinking about which new medication is being put on or trying to talk to the doctor about it, staying well hydrated are some easy things that we can do in the grand scheme of things, even in spite of, the tough road that we have to take sometimes. Now, the kidney has many functions, like managing some things called electrolytes, managing our fluid balance, and managing our blood pressure, amongst other things. So let's start off with how the electrolytes are managed. So the kidneys really work very hard and strive to maintain a unique balance of these so-called electrolytes like sodium, potassium, calcium, phosphorus, and also the acid base status, which is not the acid reflux in our stomach, but some similar ions in our blood, which maintains the pH of the blood just right. Okay, so the kidney has to do some very complex things. And then either due to kidney cancer or chronic kidney disease or chemotherapy or any of the other cancer treatments, if the kidney function has been deranged a little bit, it becomes very hard for the kidney to maintain that fine balance. And on top of that, you add in complexities like diarrhea, nutritional problems, symptoms, or if someone's having too much of nausea, they're not able to keep food in. All these things make it very hard to have a good balance of the electrolytes. So one of the most common electrolyte and important electrolyte that the kidney has to handle is our sodium. We don't want too much of salt. We don't want too little. We want just the right amount of salt. High amount, too much of salt can cause high blood pressure, water retention, and too little salt can cause our, some mental status changes and us to feel not good, throw up, and things like that. So what are some things that one can do to maintain the sodium balance well? It is first important to understand what drives our sodium balance. Whatever we eat, a good, well balanced meal with proteins and solutes really helps us maintain, or rather, helps the kidney maintain a good sodium balance. Now, sometimes during treatments or during chemotherapy, we're not able to keep food down. We're not able to eat enough. We have a lot of nausea or a lot of diarrhea. In that situation, trying to have food that is good with all solutes, with proteins, with electrolytes, and trying to avoid just drinking only water is very important. If we are unable to keep food down, then trying to supplement things with like Boost, ensure protein drinks would be very useful as opposed to just drinking water. And on the other side of the spectrum is to try to avoid high salt foods, because high salt foods will make our kidneys retain salt and water, and that promotes high blood pressure. So it's a very delicate balance of trying to have just the right amount of salt, right amount of water, and sort of balancing the amount of water intake, especially when there is nausea, vomiting, or one is not able to keep food down. And this is basically the key to having a good sodium balance and then helping the kidneys. And sometimes when in spite of doing all of this, sometimes certain cancers and chemotherapies will cause the sodium levels to go really low, and in that case we can give you some medications that helps maintain the sodium balance. But the key is to have a good, well balanced meal as best as possible, and especially in the days where it's impossible to have a good balanced meal because of either nausea, vomiting, diarrhea, and such, trying to supplement it with not just drinking water but having things like the protein shakes and such. There is a common misunderstanding that Gatorade has a lot of solute or a lot of salt. It does definitely have salt, but it definitely has a lot amount of water as well, which can cause the sodium to be imbalanced. So only drinking Gatorade when somebody has diarrhea or is vomiting is not necessarily helping all the time. So in that setting, it's important to at least try and have some amount of proteins to help maintain the water and salt balance in the body. The next electrolyte, which is very common and super important, is potassium. So the kidney does the majority of handling of the potassium, and a very little bit is handled by our gut and excreted by our gut. But the main heavy lifting of potassium management is done by the kidney. So again, like sodium, it's all about the balance, right? Too much of potassium can make our heart stop, too little can make our muscles weak and our heart also not function properly. Certain medications can change the potassium, can make it go too high or make it go too low. So we need to be cognizant of any new medications that we might take. So what are some of the things that we could do to manage potassium? So before we go to that, we need to understand that when somebody has diarrhea and is losing a lot of fluid through the GI tract, there is a tendency to have lower potassiums. If somebody is on a medication called diuretics, where they help you pee a lot, that can cause lower potassiums. There are certain medications like our blood pressure medications that can cause high potassiums. Side effects of certain medications, side effects of cancers can cause potassium imbalance. So once we identify what is causing the potassium imbalance, then determining, starting with having a well-balanced meal, supplementing potassium if it's low, managing the potassium if it's high, trying to get rid of it. There are binders that we can use, avoiding foods that are high in potassium like avocados, tomatoes, oranges, trying to manage medications that, if somebody has a tendency to have high potassium, then trying to manage the medications properly that have a side effect of causing the potassium high is also important. And then again, whenever there are GI disturbances, since the potassium handling is also in part taken care by the GI system, it's important to get the levels checked. And if the potassium is low, try to get supplements or from the doctor and things like that. Just a general suggestion to be safe. There are, like, you can get over the counter certain supplements which can alter potassium balances, like licorice can cause low potassium and hypertension, and things like that. So a general rule would be to, if you're taking any sort of supplements or if you're taking any sort of additional things on top of just a well-balanced meal, I would always highly encourage it to run it by your oncologist or your primary care doctor, or if you have a nephrologist or a kidney doctor, I would always run it by them, because some of these medications can have interactions with each other, and it's super important to be extremely careful when you're adding something new, especially if it's like an over-the-counter or a store-bought medication. The next electrolyte, or the next two electrolytes that are important, are the calcium and phosphorus. So calcium and phosphorus are very important parts of our bones, and the major handling is done by the kidney. Now, too much of phosphorus is not good because it binds to all the calcium, and they become a calcium phosphorus product and go and get deposited in our blood vessels, in our skin, and things like that. And especially when the kidney function is a little lower, the kidneys cannot get rid of the phosphorus as as we need them to be, or as efficiently as we want them to. And unfortunately, there is no escaping phosphorus. Anything that is protein protein breakdowns, or even if are colored sodas and anything that has preservatives has a lot of phosphorus in it. So trying to read, and sometimes they are not written on the food labels, so it's hard to determine how much phosphorus something has. So when I talk to my patients, I generally tell them that if you're using canned beans, wash those beans to wash off the preservatives. Try to use more frozen foods than canned foods if possible, because frozen foods tend to have less preservatives, thus less less phosphorus. Sometimes your doctor might give you calcium supplements, because certain medications can cause calcium depletion, so like steroids or certain other medications. And then sometimes the doctor might give you vitamin D supplementation and things like that. But on the other hand, it is also important to not have too much of calcium or too much of vitamin D, because too much of calcium can also cause things like kidney stones. It can cause high blood pressure. It can cause severe constipation. So again, the name of the game is balance, right? To have the right amount of each of the mineral, calcium, phosphorus. By the end of my talk, you'll realize what a balancing act the kidneys have to do. And just think of it, if there is one less, or even a part of one is missing, or or both of them are deranged, our body needs to go through a lot of changes, especially because these elements need such a meticulous fine balance. And believe it or not, whatever you put into your body, your food, your drinks, your beverages, is 90% of the times that's what you need to control moving forward. And then the medications and things like that. But whenever you talk to your doctor, and they might check your calcium levels, they might check your phosphorus levels, and then before you take any Tums or any supplements, just talk to your doctor again to make sure that the levels are not too high or too little. Now, switching gears a little bit, another super important function of the kidney is to manage the fluid balance. And when we talk about fluid balance in the body, it is, it can manifest as your what we sometimes refer to as wet weight, or swelling or edema. And the truth is that the fluids that we take in does not just constitute of water. Teas, coffee, soda, soup, Gatorade, any sort of supplements that you might drink is except for the protein supplements are all considered fluid. And on one hand, we need to keep well hydrated, and we need to make sure that, say, if you're working out or doing an exercise, you probably might need a little more hydration than if you're just not having a busy day and just taking it slow. The weather might play a very important role on our fluid intake. And importantly, other comorbidities, like if somebody has liver disease and their belly swells up with ascites or fluid, then their fluid intake on top of the kidney problem is going to be even more stricter. Or if somebody has heart disease and kidney disease together, their fluid intake is going to be even more restrictive than somebody who just has kidney disease. So managing fluids, or rather managing the fluid status in a patient with kidney problems, also depends on how the other organs are doing and what the other organs need. So it's kind of complex. And this is one situation where one size does not fit all, because for what might be a normal fluid intake or a normal water intake for one patient might be too much or too little for the other. So whenever patients ask me about, so what's the general, how much water should we drink every day? I unfortunately have to tell them that this is not something that, it can fit everyone. And it has to be individualized to what your condition is. Say if somebody is having diarrhea, or if somebody is on diuretics or something like that, then, the requirements might be very different as opposed to somebody who is doing otherwise okay and has no other ailments. All right. One last thing about fluid and volume status is that there are certain things one should look out for in terms of understanding what the fluid intake, how the fluid status is. So if one notices that the kidney with kidney problems, if the kidney, or rather, if there is a decrease in urine output, that's a warning sign. And sometimes the decrease in urine output after diarrhea or after like severe nausea, vomiting might indicate that you need more fluids. Whereas sometimes when there is a decreasing urine output, that might be a sign of, okay, the kidneys are not working. So it is really important to understand things like appearance of swelling in your feet, or your weight going up, or shortness of breath when you walk, or how much urine is being put out. So all these are certain markers to assess what we call the fluid status or the volume status of a patient. And just knowing these things will make you more aware, and will make you more cognizant of what to look for when you are having to manage your fluid intake. Another very important role of the kidneys is to manage blood pressure. So the kidneys help regulate blood pressure by regulating sodium quantities, by regulating the fluids. There are some other pathways that help the kidneys manage blood pressure, but the kidneys play a very, very important role in managing blood pressure. And unfortunately, there are several medications, anti-cancer medications, that are used to treat these, not just the kidney cancer, but several cancers that can cause high blood pressure. Now, leg swelling, or like I mentioned earlier, could be one subtle sign of the fluid overload, and eventually it might correlate to high blood pressure. And long-term high blood pressure is not advisable or not good for the kidney. So it is important to measure it quickly, identify what signs of high blood pressure or volume overload could be. And again, what are some of the measures? Avoiding salty foods, talk to your doctor about medication side effects and blood pressure medications. If they are changed around the surgery or around the chemotherapy time, it's important to keep track of those changes and manage and get help after the surgery or after the chemotherapy episode has has ended, So in summary, the kidney plays a very, very important role in managing things like blood pressure, fluids, volume, electrolytes, and kidney dysfunction, and not just kidney cancer, but any cancer has a very close relationship. And there is a significant overlap in the patients who would have cancer and the patients who would have kidney disease. Actually, there is what we now call a survivorship issue, that when patients survive cancer as a result of the therapies can have chronic diseases, and kidney disease is one of them. So treatment of kidney cancer can cause changes in the electrolytes. So treatments of the cancer by themselves can also cause changes. And the baseline kidney function is pretty much very, very important to determine the path the patients are going to take in the future. And also remember the comorbidities, like I said, what the patient is doing and what the kidney is doing, both need to be considered. Be mindful of medications that you may take over the counter on your own and run them by your doctor. Lastly, a well-balanced nutrition, and like the earlier speaker said, having a investing in a good lifestyle of exercise, active lifestyle, avoiding smoking and such, really would help the kidneys along the way. And finally, a multidisciplinary approach with your oncologist, your primary care doctor, the integrative care doctor, all of us together can we work together in helping your kidneys stay as healthy as possible.